بسم الله
تفضل.
الرحمن الرحيم. الحمد لله رب العالمين، وأصلي وأسلم على نبينا محمد وعلى آله وصحابته أجمعين. First of all, I would like to thank you, Dr. Hanadi, for this excellent, well-organized work, and you are able to call all the people from all over the world, and we could celebrate this conference by collaboration and cooperation from all country all over the world. So I really appreciate your hard work in this important conference. First of all, I would like to mention the main aim of my presentation, and I will focus mainly in some terminology, starting by definition of health technology and telemedicine. Also, I will focus in some key point of the benefit and what are the challenges and some important consideration. Also, the current trend and the future look of the technology in the medicine. I will mention some of success story and update in the health technology and telemedicine. Let me start by definition of health technology. Actually, health technology referred to the use of technology to improve health care delivery management and outcome. It consists of a broad range of digital tools, devices, application and software design to enhance patient care, healthcare operation, facility, innovation in medicine. I will mention some of the examples that include electronic health record and also health device, medical image, software, the use of artificial intelligence in the diagnosis, especially in radiology and pathology, health analytic platform. Telemedicine basically defined as division of health technology, which more focused mainly on healthcare remotely through telecommunication technology, and it allow patients to consult with healthcare provided through phone, video, or online messages, and also it reduce the need.
Excuse me, Professor Ali, would you mind to share your slide?
Well, I am using my phone, so it will be difficult for me. I send it to you by WhatsApp, but it's okay. I can manage by covering all the.
From my end.
Yeah, I can manage by focus in the main important title that I already mentioned, and I will mention it as a story, so it will be understood by everybody. So we differentiate now between the health technology terminology and the medicine, which subsist health technology focused mainly in provide the service remotely through the telecommunication that allow the patient to consult with healthcare provider through the phone, through the video, through consultation, and the physician or the consultant will be able to manage and provide advice to his patient from the distance. The key benefits of this important technology and telemedicine Number one is to provide patient information that he needs. Number two, to reduce the healthcare and cost of resources and utilization. Also, it will fast the diagnosis and treatment plan. Again, enhance the remote monitoring of, especially for the chronic diseases like diabetes mellitus, bronchial asthma, hypertension, and epilepsy. Also, it will improve the engagement of treatment plan. Definitely, there are many challenges and consideration that we have to consider with use of the telemedicine, especially the data privacy and security. Also, the regulatory of policy procedure guideline of the use of these important technology, and to ensure the equitable access across the population. Integrating the new technology into the existing healthcare system. And now I will focus in the current trend and the future outlook, especially the use of the artificial intelligence machine learning, increasing the use, especially in the diagnosis, in the radiology, imaging, and predicting health care trend. The virtual care platform are also expanding, integrated with other healthcare data system. Also, the regulation framework to support the telehealth care services. And recently, thank you for sharing my slide. And you can go, I think, to slide number 12 now. I reach number 12. Virtually, the care of the platform are expanding, and recently in the Kingdom of Saudi Arabia, it has been rapidly expanding over the recent year, driven by the government initiative, technology advancement, and increasing the need of accessible healthcare system, which has been started in 2018. The Saudi digital health strategy was launched to promote digital healthcare solution, which include telemedicine and improve healthcare delivery and across the Kingdom of the Saudi Arabia. In fact, we establish many regulation, many policy procedure to overcome the telemedicine, ensuring the quality and safety, and to have effective communication and information technology commission. And this is, in fact, play a central role in regulating and facilitating the telehealth service. Healthcare provided in Kingdom of Saudi Arabia company or government hospital, like, for example, in Ministry of Health through app and website. There are many type of telemedicine. This type include virtual doctor consultation, remote monitoring of chronic conditions such as we said before, diabetes, hypertension, and bronchial asthma. There are also telemedicine just for medication and delivery service, and to give the patient advice how to use his medication. Also, this telemedicine play an important role in mental health care support through the online counseling. The updated use of telemedicine, and this is what we call in the future of healthcare, especially the use of artificial intelligence, which play a very important role. And I believe that we should add this in our curriculum in every curriculum plan in College of Medicine. And in fact, the updated up to 2025, the health technology sector continue to expand significantly and driven by advance in technology, changing patient need and increase health demand. And just here, I will mention some of the example that really achieve important development. For example, the adoption of post-pandemic COVID-19 pandemic accelerated adoption of telemedicine globally, and this momentum continue many health provide and increase the telehealth technology. Now we could use many Apple website, and also this in fact have been reflected in the healthcare system. As we also mentioned before, the integration of artificial intelligence is being increasing integrated into the healthcare solution, aiding to diagnosis, personal information, treatment plan, patient monitoring, and even administrative tasks. Also, it enhances the patient engagement, especially data security, innovation, focus in improving. Also, expansion of the use of telemedicine in psychiatric patients and mental health care apps. Mental health care service via telemedicine are going providing accessible support association with seeking the help, especially for those difficult patients. The government and the regulatory body are updating better accommodate telehealth care service, addressing issues like license, reimbursement, data privacy, virtual reliability, and focus in digital diagnosis, at home testing, rapid home testing kit, and digital diagnosis tool expanding, making healthcare more accessible and convenient to many patients. So, in overall, the healthcare technology and telemedicine are on the path of rapid innovation, aiming to improve healthcare accessibility, efficiency, and quality, while addressing challenges related to regulatory and interoperability and data security. Globally, there are many success story. I think my colleague have been mentioned some advancement in India and also in Africa. These, in fact, have significantly improved the health access for more population, especially like the project like Apollo Telemedicine Network Foundation in India, and also it has been applied and utilized in many countries, especially for the specialist consultation. In the United States, for example, they use the telehealth care platform such as Tilado and Amwell. I have expanded access to specialists, especially in mental health care service and routine care during COVID-19 pandemic. These services grow and reducing the need for person visit and easing the healthcare system. And really, our experience in pan-endemic COVID in the Kingdom of Saudi Arabia, it was very successful story. The stroke care and telemedicine of stroke program used by the neurologist and the neurosurgeon, it make treatment decision for stroke patient remotely, and this has fastened the intervention time and improve recovery outcome, especially in rural area. Again, the chronic diseases management, telemedicine was very successful in managing a chronic condition virtually, allow continuous tracking and time intervention, and reducing the hospitalization and improving the patient. Of course, the ethic consideration. I recently wrote a book in advanced medical education and healthcare system, integrating the use of technology, and I wrote a special chapter about the ethical consideration, especially in data collection and protection. It has to be respected, and we should have a clear law and policy procedure using this new technology, especially to establish the guideline of data processing in individual healthcare system. Also, I want to mention that one of the updated in use of the technology is remote diagnostic and image, especially in radiology and pathology. We call it telepathology or teleradiology, which allow the specialist to review the image and also to review the biopsy slide from far distance, reducing diagnostic time and increasing the accuracy, especially in emergency and resource limited setting. If we go to the next slide, I will come to the conclusion. So in summary, the telemedicine is a success story that highlight and improve healthcare accessibility faster, especially in the diagnosis, cost saving, and better patient outcome across diverse medical field and region. Also, the health technology it will bridge the gap that require strong policy, ethical and infrastructure support. By the end of this, I reach the end of my talk. Again, I would like to express my thanks to you, Dr. Hanadi, specifically for this well-organized conference, and the door is open for any question. Thank you so much. We can't hear you, Dr. Hanadi.
Many thanks, Professor Ali, for your presentation. It was amazing. And this session is focusing about the most important things is about the health tech, and all the country now it's converting to the health tech and telemedicine. Now we will going for the next presenter, accept our apology about the Professor Hassan al-Bahrani. Unfortunately, he made an accident, and thank God he is in a good shape. But there are some investigations around them. This is the reason why he's missing this session, and I take care about this session. Dr. Sahar Jifal, you are the next presenter. You will have 15 minutes to present your presentation and or your slides. Are you in?
I would like to ask permission because I have surgery to do it now in the private.
Dr. Ali, feel free to leaving our conference. It is our honor to have you every year. Thank you.
Thank you. Thank you so much.
The technical support, Dr. Sahar.
Yes, I can see Sahar over here.
Sahar Jifal. Take her inside. Yes, I think she's, you can stop the presentation for Dr. Ali. Go ahead. And the floor and mic with.
Hello, can you hear me, please?
Yes, go ahead, Dr. Sahar.
Okay. Hello, everybody. Today I will talk about the patent automated primary cells triturator, which was registered in USPTO in August 2025. This patent was invented by myself. My name is Dr. Sahar Jaffar. I am working at Faculty of Dentistry, Applied Science Private University, and by my sister Maram Jaffar, who is working as an architect in Kuwait. So first, before I start talking about my patent, I wanted to give a little introduction. Usually in scientific...
If you extend your presentation to be full screen, it would be better for all of us.
Okay. Can you see it now?
Thank you so much. Thank you. Go ahead.
Okay. Okay, well, you are welcome. So usually in scientific experiments, it is important to use the primary cells, and the primary cells are the cells that are extracted directly from animals or human. There are so many advantages for using primary cells. For example, we can avoid the variations that are going on in vivo, in the in vivo experiments, because when we inject drugs or any material in the body, there are so many variations that are coming together. So it is difficult to recognize the effect of certain drug or any material. Example for primary cells, extraction of dorsal root ganglia neurons, DRG neurons. So usually we can extract the DRG from DRG neurons from the spinal cord. So they are enclosed, as you see here, by connective tissue. It is little tough. So we need to extract neurons that are inside the cell bodies. So in the experiment, these DRGs are placed in specific media with specific requirements. For example, if we are using neurons, we should add nerve growth factor into the media. Also, we should add enzymes such as collagenase in order to dissolve or separate this connective tissue. So the first step includes adding enzymes. The second step includes using mechanical disaggregation, a process that is called trituration. And for trituration, we need Pasteur pipettes. The way that trituration is done is that we aspirate this media that includes the DRGs and enzymes, aspirated, then dispense it for so many times, it can reach 150 times. So I take the solution up and down so that the enzyme can separate dissolve the connective tissue and the neurons can be separated. And we use for this process, the trituration, two types of pipettes, the wide bore pipette and the narrow bore pipette. Usually, in many labs, the narrow bore pipette can be created manually by using a flame, and this will lead to wasting of so many pipettes because sometimes we cannot get the correct narrow diameter. So either it can be more in diameter or less. So it is not an accurate method to do it. So as you heard from the process, so this repetitive trituration, it is challenging and time consuming. If I did it, for example, for 150 times, sometimes there can be a variability in the force of aspirating and dispensing the solution, and also doing it for 150 times, it is tiring for the muscle. So there can be variations in the forces and number of triturations, and this can affect the yield and survival of primary cells. So because necessity is the mother of invention, so I thought of a solution. The solution for me, or the idea, was to make an automated primary cells triturator, as you see here, in which, for example, I can place the sample in the machine and I can select the speed, volume, and number of triturations in order to do it automatically and save myself time, effort, and also money. Because if we did not create thin flame polished pipettes correctly, so there will be wasting of pipettes and others. Yeah. Okay. So this is the design of the machine. Okay, the design of the machine. So you can see here that the machine has a charger. It can work by electricity or lithium battery, so that the user can transfer the machine into the laminar flow or workplace. And here we can put the sample. There are pipettes. And with the machine, we provide the user with two types of pipettes, the wide bore pipette and the narrow bore pipette with fixed diameter. So no need to do or to create the thin flame, the thin narrow bore pipette by using a flame. And here the user can put the sample. These caps are perforated in order to allow gas exchange and to avoid changing in the pH of the sample. Here we can, number or the letter G shows that the user can put many things in this drawer. We have base. This is the switch of on and off, and this is in J, we can have a digital screen that is showing the readings, and I can select, for example, the speed, volume, and number of triturations. There is a place for motor and for lithium battery, and of course there is outlet nozzle here, and a place for the charger. So this was the idea. So there are so many advantages for using the automated primary cells triturator. First, it helps in extracting primary cells using a steady force and speed, and also it helps the user to select the number of triturations. So it is easier, for example, to do 150 times with a fixed speed by using the machine instead of doing it manually. So the apparatus is helpful for avoiding problems of culturing unhealthy cells or wasting materials, because for culturing primary cells, we are using expensive materials, such as, for example, culturing media, the supplements that are added to the media, nerve growth factor. If we are using a construct for DNA, antibodies, animals, filters, all of these, the cost can be saved by culturing primary cells correctly and by increasing the survival and yield of primary cells. So it is helpful for the isolation of primary cells in a homogeneous manner, as I mentioned, by using pipettes with fixed bores. I don't need a flame to create thin or narrow bore pipettes. Okay. So, as I mentioned, it is helpful for avoiding the creation of flame polished pipettes. The user can get the automated primary cell triturator with the accessories, the pipettes with 2 diameters. Also, the triturator is helpful in avoiding the problem of formation of bubbles and insertion of carbon dioxide into the media. Usually, the color and pH of this media can change by insertion of gases. So if we did the trituration manually by aspirating the solution up and down, this can lead to insertion of bubbles or carbon dioxide that can change the pH of the media and can affect the cells. So we can culture unhealthy cells. By using the automated primary cell triturator, we can avoid this problem. Okay. As I mentioned, the triturator can be chargeable and portable, and this because it has also a small size and it has lithium battery, so it will make it easier for the user to use it in the place that he or she is planning to do the experiment. So in conclusion, the triturator can save the efforts and times of researchers and can decrease the costs of the experiment. This can be useful in many fields. It is not only in neuroscience, it can be in cell biology, developmental biology, transplantation, molecular biology, or any fields, because we need to culture primary cells from many sources. So actually, I use it. I thought about it when I was culturing DRG neurons. I thought to name it a neurotriturator, but when I looked at the procedure, I found that so many primary cells can be cultured in the same way, like muscles. For that, I changed the title of the patent into automated primary cell triturator, and I found that it can have many advantages or uses in different fields. So thank you for listening to me. By that, I end my talk, and I welcome any questions.
Great thanks for Dr. Sahar Rifat. She is an inventor. She is a leading inventor in health sectors. More than welcome for your this invention, and we're looking forward to have more and more of invention. As
Thank
you
you
know,
very much.
the roots of the invention, it's not ending with first invention. You can build in this invention several inventions, because only you are a such person in the world knowing about your inventions and the way you invented this invention. Thank you so much. Now we will be going to the last presenter, Professor Michael Watts, and he is also the CEO for co-founder and CEO for Plum Health. Go ahead,
Thank you very
Dr.
much, Dr. Hanadi, and thank you for all the listeners, and good luck.
Thank you. Go ahead, Professor Mike. You have with you around 13 minutes instead of 15 minutes. Then we will be closing that. Thank you,
Fantastic.
Tom. Go ahead.
Thank you so much. Shukran, Dr. Hanadi. Good morning, good afternoon, wherever you are in the world. Assalamu alaikum. My name is Dr. Michael Watts. As Dr. Hanadi says, I am a physician MBA based here in the United Kingdom. I also have a organization called Bloom Health. So we build solutions primarily for the UK market, but we also do a lot of work across the GCC as well. I'm very excited to be speaking to you today. We do some amazing work across the Gulf, and it's always a pleasure to be with you. Let me just share my screen. Um, okay. So I wanted to talk to you today about my experience and our experience of healthcare revolutionization from a clinician's perspective, of course, but also as a business, as an organization that is really changing the way that we do healthcare. I'm going to come to you from a UK perspective and a Great British perspective, but I recognize as well that the GCC is also rapidly it being innovative in the way that we deliver healthcare, and in many ways actually moving faster than the UK. Believe it or not, we are very slow, lots of bureaucracy. So whilst we have some amazing capabilities, because of the legacy and the sort of historic makeup of our healthcare system, it often can also mean that when we want to bring about change, it's a lot slower. So this is why I formed an organization called Bloom. We build solutions, we build digital and AI capabilities for hospitals, providers, payers, family physicians in multiple parts of the world, as I say, here in the UK, also in America and Canada, and across the GCC. So, what does the shift to telemedicine actually mean? Well, at Bloom, we look very simply at how we can revolutionize healthcare, and it's in three ways. One, keeping patients out of hospital. Two, reducing down the amount of time that we keep patients in hospital. And three, making sure they never come back. Now, if you look at those three in isolation, 2 out of 3 of those happen in the community. So actually 2 of those capabilities are about supporting patients in the community. So trying to prevent patients coming to hospital, well, that translates to preventative healthcare. Reducing down the time that they're in hospital, that is operational efficiency. And then making sure they never come back is effective discharge, virtual wards, virtual care. So being able to treat a patient in the way that we treat patients in hospital, but from the comfort of their own home, brings many benefits. We know this. It's cheaper because actually a hospital bed is expensive. It's better for the patient. They prefer to recover at home most of the time. And actually, from a capacity perspective, building a hospital is expensive. So the more cost-effective way is being able to be a hospital that goes beyond the 4 borders, the 4 walls of the hospital building. So if you can provide hospital quality care without the patient needing to be in hospital, that is high impact and cost effective. We've seen a change in the way that we engage with patients internationally. Gone are the days where you need to be sat in front of a clinician, a healthcare professional, having a conversation there and then. The way in which patients consume healthcare data and healthcare education has also changed. Some patients don't necessarily need to have an answer straight away. They can wait. So asynchronous messaging has become really, really quite at the forefront, whereby a patient can ask a question and they need to know within the next hour, but they don't need to know straight away. And that's really changed the way that we can support patients whilst not overwhelming human resources. Obviously, we've taken that a step further and actually looked at how we take the human out of the loop altogether. And so AI supported triage, AI supported engagement is really changing the way that we do healthcare altogether. But it comes with risks, of course. AI is not always accurate. It needs training. It can be expensive. So AI is definitely the way that we are going. But we have to recognize that as much as there is gaps in the market, we need to understand, is there a market in that gap today? And I know that many countries across the world are really leading in this. And the Gulf is no exception, of course. That being said, we have grand ambitions. And for those of you that's not engaged with the United Kingdom before, we would encourage you to do so. I do a lot of work with engaging with healthcare professionals, business owners, hospital executives to come and visit the UK. I'd be more than happy to host you if you wish to visit to see our hospitals in action. We have some world-class mental health hospitals. We have some world-class genomics capabilities. We have some of the biggest pharma companies in the world. We're not perfect. As I say, we move slowly because of the complexity of our public health service. But our public health service also has some of the best access to data in the world. It has some of the best care in the world. It has world-renowned pediatric hospitals as well. So there's lots of good lessons to be learned from the United Kingdom. And we have a 10-year plan which you can access actually. And if you need to, if you can't find it, please let me know and I will link it to you. And it has digital and AI all the way through it. It has telemedicine in there as well, particularly in certain specialties like dermatology. So fundamentally, we recognize that even for an organization or for a country like the UK that has highly sophisticated healthcare provision, we recognize that we can still do more. We can still do more in the way that we support patients. It's very hard for us to build a hospital. There's not much space here. So we have to think about how we can treat patients not in a care setting. And this is one of the key things that we're doing. And we have lessons to be learned from our international partners too. We have a number of capabilities at Bloom that are unlocking this capability, not just for the UK, but internationally as well. We actually have a virtual ward. It's called Nexus by Bloom. It allows for a patient to have that experience whereby they can prepare for surgery, they can be treated at home, we can support their mental health. And this is all done via a mobile application. We can actually also monitor adherence for things like diabetes. So if someone is using insulin pens, we can track their dosing and make sure that they are taking all of their medication as prescribed. We also have a AI referral management solution that looks at a referral letter. It uses AI to extract the patient demographic data so we can understand whether the patient is known to the hospital or not. And then we can assess the level of risk for that patient. And based on that risk, we can identify how fast they need to be seen. So effectively, this is a caseload optimization tool. It looks at all of the patients in your population. It tells you who are the highest risk and therefore who needs the most urgent care and therefore who is going to get the best return on investment from a hospital resource perspective. And we've also built an agentic AI solution. It's a cancer solution that calls patients in between their chemotherapy. So as we know, chemotherapy is cyclical. They have to come in once a week, but actually our AI calls them every day. Every day it asks them how they feel, whether they have any symptoms, whether they have any adverse side effects. And based on what it finds, it summarizes that conversation and it presents it to the healthcare professionals for side effects, and it presents it to the pharma company for adverse events and looks at whether or not we need to change the dosing for that patient. So 3 really impactful projects that we're working on at the moment. These are readily available to the market. I would be more than happy to share them with you for you to look at, explore, understand, and learn from. So do let me know, and I'll share my email at the end of this if you want to find out more information. So where are the opportunities for transformation as we know it? Well, we know there's a diverse population. We too have a diverse population in the UK, and we know that there are growing long-term conditions like obesity, diabetes, cardiovascular disease, for a whole host of reasons. It's an ever-increasing problem here in the UK as well. We're looking at how we can prevent cardiovascular disease and automatically screen patients. We can actually do some really clever things like look at what they're consuming and what they're buying from supermarkets, and actually based on their shopping, assess their risk of cardiovascular disease. There's a data protection element to that that is a challenge for us, but again, the impact that it could have is profound. We know that you have significant digital health strategies. It's the whole reason that I'm here talking to you today, because you have leaders like Dr. Hanadi organizing this thought leadership and this international conference to be able to share knowledge. And I'm really excited to be a part of your network and your country. And again, leapfrogging systems, the benefit of not having archaic and old systems in place like we do here in the UK is that you have a blank canvas. You have the ability to actually bring in the most up-to-date capabilities, which actually puts you ahead of some of the countries like the UK. We've seen massive disruptions in countries like the Kingdom of Saudi Arabia, where they have a totally virtual hospital in Seha by the Ministry of Health. So again, the ability to be able to try something new is better when you don't have pre-existing and legacy infrastructure in place. But what does it take? It takes time. It takes governance, because as well as trying new things and taking risks, we need to ensure that we always think about patient safety and that we take the responsible approach. Because as I said before, AI is phenomenal. It will change the way that we look after patients. It will change our jobs as healthcare professionals, but it can also create risks. There is a famous saying that if you invent the ship, you also invent the shipwreck. I don't know how to translate that to Arabic. I've only just started learning it, but essentially it means that when you build something new and innovative and disruptive, you also build something that is equally as harmful. And it's about reducing down something that can cause harm whilst getting the most out of the thing that brings great benefit to your populations. Infrastructure. To be able to run digital and AI, you need good hospital infrastructure. You need good Wi-Fi and connectivity. Even in parts of our hospitals, we still cannot get connection. If you have to work offline, it creates mass disruption, especially where you're using cloud services. And cybersecurity, you only have to look on the media in the UK to see cybersecurity breaches over the last few years in healthcare. And there was an attributed death to one of the cyber attacks. So really serious stuff, and we can always do more when it comes to cyber threat. Workforce adoption, one of the biggest challenges that we have is change. All of our healthcare professionals are busy all the time, which makes it really hard to get them to look at something new, try something new, have the capacity to try something new. So you have to take the clinicians on that journey with you as an innovator, or even as a senior executive of a provider organization. You need to inspire your workforce to want to change with you, because sometimes they're too busy in caring for patients, which is exactly what they should be doing, to take that leap of faith. And patients, again, patient engagement, patient trust, these are some of the biggest challenges. We see trust in healthcare AI being one of the biggest barriers to adoption. So taking that patient on that journey with you, giving them something that's not AI in the first instance, and then weaving in that automation capability builds trust with that population. It enables you to demonstrate the value that you're going to be having, so that your workforce and your patients experience it in an ethical and controlled manner. And where are we seeing the best benefits? Well, we're already using AI in a lot of diagnostic capability, triage, looking at how we can make decisions faster. At the moment, we still keep a human in the loop for a lot of the clinical decision making that we do with our AI solutions at Bloom. But the idea is that over time, we'll remove some of that human engagement. Wearable devices and robotics, we know are fundamental to the way that we provide personalized care. We're working on a fantastic project again in KSA around monitoring Hajis through Hajj, and being able to monitor their vital signs and their baseline, so that if we see any adverse health condition, that we're able to intervene, and Red Crescent are able to support that patient based on their GPS location and based on their pre-existing health passport. We're able to analyze large amounts of data like never before. This is fundamental when it comes to looking at large populations and being able to plan for spend. So this really does take an impact in a regional and national basis. But actually, if we have this data, we're able to look at chronic conditions better. We've trained an AI model to look at 10 million retinal scans of eyes. And now we're able to tell you how bad someone's diabetic retinopathy is, not by a 4-stage disease, as we learned at medical school, but actually how bad it is on a scale of 1 to 10 million. And what that enables us to do is fine tune the budgets that we allocate to living well, screening, treatment, and actually it's too late, that patient is going blind. And hybrid care models. We recognize that not everybody can be treated in their comfort of their own home. And sometimes we need to be able to give patients that experience that works best for both the hospital provider and the community provider and that patient's circumstances. So that is everything. I think I am just on time. I have 2 minutes left for questions. Here you can see my contact details. I'd be more than happy to follow up with anybody that is wanting to speak with me. I am actually moving to the region in January, inshallah, because my wife has actually started maternity leave. So it's a great opportunity for me to connect with yourselves, spend more time in the region that I love, and get to know you all. So thank you so much for your time. Any questions before I leave?
Many thanks, Professor Mike Watt. It was amazing presentation,
Thank you.
and we enjoyed to knowing the updated information about the health sector and telemedicine.